Welcome, this is Dr.Lena Edwards, and this is the webinar on female sex hormones. So this webinar is going to teach you everything you need to know about your most important female sex hormones, estrogen, progesterone, testosterone, and DHEA. So this is going to be a great learning experience for every woman because regardless of your age, you have hormone imbalances at some point, and this is going to get you started on the road to understanding what these hormones do and how you can help improve hormone balance. So with that, let's just go through the objectives of this webinar. First thing we're going to do is talk about the actions of each of the individual hormones. We're going to talk about what they do, why they are important for your body, and then we're going to talk about the symptoms of deficiencies so that you can isolate and identify some of the symptoms that you may or may not be having in relation to the hormone imbalance that may be present. I'm going to just go through female hormone transitions, what's the difference between regular menstruation versus perimenopause versus menopause. We're going to talk about estrogen dominance, which is a very important factor for every single woman. We're also going to talk about some of the things that affect your female sex hormone levels, things that are under your control. And then we'll go on from there. So I do want you to note that there is an accompanying PDF file that I have created that summarizes the majority of what is in this webinar, but it's in a written form that you can also have handy, and you can take notes on that PDF as you're listening to this webinar and then use it for future reference. So we are going to start off by discussing the actions and the symptoms of deficiencies of each of the individual hormones, estrogen, progesterone, testosterone, and DHEA. And we are going to start with the most important female sex hormone, which is estrogen. Estrogen is the primary female sex hormone, and it is what causes all of these secondary sex characteristics that we develop from when we're basically born until we become women. So the development of breast tissue and pubic hair and our growth as far as our bone health and our height, all of those things are basically attributable to estrogen. Our body actually makes 3 different kinds of estrogen, and this is really important because this is going to come in. This information is going to be becoming very useful when we start talking about bioidentical hormones. But the most potent type of estrogen that our body makes is called estradiol. And so when you're looking at you having normal periods and having normal breast development and having normal sex drive and all of those things, it's really the estradiol that's doing that. 95% of our estradiol is made in our ovaries, but the other 5% can also be produced other places, such as your brain, your heart, your blood vessels, your adrenal glands, and your fat cells. And so that's important because even after women go into menopause and their estradiol levels drop significantly, they're always still making some estradiol. And estradiol is the most potent of all of the 3 estrogens. Now, once you go into menopause, the primary form of estrogen we produce is called estrone. And estrone is made in ovaries, but it's also made in fat cells. And so women that are overweight will also make more estrone. Estrone is about 1/12 as potent as estradiol is. So obviously you're not going to have the favorable effects that you have with estradiol. Also, we don't want to have a lot of estrone around because it can be metabolized into byproducts that can predispose us to developing breast and uterine cancer, which is why women who are overweight have an independent risk factor for developing cancers like that simply because they're overweight. And it has to do with the level of estrone present. And finally, the third type of estrogen we produce is called estriol. And estriol is only about 1/80th as potent as estradiol is. So it's extremely weak when comparing it to estradiol. And it is the end byproduct of healthy estrogen metabolism. So once our bodies are finished using estradiol and estrone, both of those things have to be metabolized into estriol in order to be eliminated from the body. Okay, now the thing about estriol, and this we're going to talk about more in the bioidentical hormone replacement section, but estriol is actually used in bioidentical hormone replacement. And in some patients who have had breast cancer or are afraid to take estradiol, sometimes the doctors will prescribe estriol only. However, doing that usually is not as helpful because, again, it's not nearly as potent as estradiol, so you don't get the protective effects of the heart on the heart and the brain and the bones that you do with estradiol. So why is estrogen so important? Everybody freaks out about estrogen. Estrogen causes cancer. Well, it doesn't. And we make a lot of it, especially our peak production is about age 25. And it is very, very important and responsible for numerous different metabolic pathways and different organ systems in your body to work correctly. Okay, so when you're looking at the GI tract, actions of estrogen include reducing ulcer formation because it actually increases the production of bicarbonate in your stomach. Studies actually using estrogen as estrogen replacement showed that it reduces colon cancer, but also it can slow down your stomach motility. Eye health is markedly improved with estrogen. It improves the blood flow to your eyes. It also helps to prevent cataract and glaucoma formation. Estrogen also protects your kidneys. Now, if you want your brain to work, you've got to have estrogen around. And that's because estrogen does a lot of very important things that are required for optimal brain health. So it functions as an antioxidant in the brain. It's also an anti-inflammatory. So antioxidant means it helps prevent cell death and repair DNA damage. And anti-inflammatory means it reduces inflammation. It's very, very important for improving blood flow to the brain, and it also increases brain cell survival and brain cell growth and the formation of new blood vessels in the brain. It's also responsible for the function of the brain chemicals called neurotransmitters that are essential for such things as your mood, your concentration, focus, and your sleep. So things like dopamine and serotonin, and then another hormone called acetylcholine, all of which are important for focus, memory, mental function, and mood, all are not going to work as well without the presence of estrogen. So for those of you that may have been given antidepressants and you no longer make enough estradiol because you're in menopause, a lot of the times those antidepressants will not work very well because, again, without enough estradiol in your system, serotonin isn't going to work as well as it should. And antidepressants do not cause a rise in serotonin. They just cause whatever serotonin is there to work better. So if it's not there in ample amounts to begin with, and it can't work as well because estrogen's not there, then those medications obviously are not going to work as well. And what about heart health? Estrogen is probably the most important hormone for cardioprotection in women. Much like in the brain, it increases blood flow, it increases blood vessel formation, it lowers blood pressure by improving the way that your blood vessels function, it decreases cholesterol buildup inside of your blood vessels, it's a very potent antioxidant, it improves cholesterol profile, and it decreases blood clotting. Now, this is talking about your own body's natural estrogen. We're not talking about estrogen pill replacement, okay? So this is your own body's estrogen, what it does. And it also helps to regenerate the muscle cells in the heart. Now, a lot of women that are fearful of using properly dosed bioidentical estrogen are concerned about the potential issue with breast cancer. First of all, when we talk about how we're going to do the bioidentical hormone replacement, it can be done safely and effectively without increasing your risk of breast cancer. In fact, most women who get breast cancer never take estrogen at all. And we're going to talk about breast cancer here in just a moment. But the breast cancer is actually the top, I think, number 5 or 6 cause of death in women. But heart disease is actually the number 1 cause of death in women. And being estrogen deficient increases your risk of developing heart disease 50%. So estrogen is an incredibly important heart protecting hormone, and another strong reason to consider replacing estrogen if needed to help for protecting your heart, especially if you have risk of heart disease and high cholesterol.